Hello, 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 hello. Okay. My name is Dr. Jay Suryan, physician from AVPRF, and I am handling Marma and fracture here. So today we are going to see about how does Ayurveda helps you in sports injury. So actually, Ayurveda plays a very important role in managing many type of injuries because most of the orthopedics cases are being, which are in chronic cases, are being dealt beautifully through Ayurveda. So here the topic, so injury. So before going to the orthopedics, there are some basic things which we have to learn when it is coming to the sports injuries. Here, not only it is being confined to sports injury, but also the injury, because as the word injury it is coming, we think that Ayurveda only focuses on the chronic cases, which we cannot deal with these kind of cases, but we can with our medications. So, according to the modern view and what happens in an injury, we can see that there are tissue damages, inflammation phase, and repair and remodeling phase. These are the three phases which happens when an inflammation starts. Means an injury will be giving rise to the inflammation in the next subsequent levels. So tissue damage. In the tissue damage, the cell rupture takes place and the blood vessels may break. So what happens when the blood vessels breaks, there will be the oozing of blood inside the small capillaries or the veins, which will be oozing the blood through the tissues. And therefore, it starts by releasing of inflammatory chemicals, which is a process of healing. Then inflammation phase starts. This starts after 0 to 72 hours. So tissue damage is an acute stage whenever an hit or an injury happens to your body. This tissue damage is the first stage which is taking place. Then the repair mechanism, which is called as the inflammation phase, starts. In this, swelling, redness, pain, and warmth. Rubor, Calor, Dollar, and Pallor. These are the main inflammation signs which we are seeing in an injury. So white blood cells cleans up the damaged cells. So first swelling takes place, eventually redness, pain, and burn. These are happening. Then white blood cells cleans up the damaged cells. After that, the third phase becomes repair and remodeling. Here, collagen forms the scar tissues. White blood cells is being cleaned up the damaged cells. Then to the next step, the collagen forms as scar tissues. When the scar tissues are formed, the inflammation is being transferred to the repair stage and then to the remodeling stage. So here the tissue regains the strength over weeks to months. Then what happens? The tissues slowly tends to come back to its strength the- by weeks and to the months. Then that follows the subsequent treatment protocol which are being followed in the stages. So here Ayurveda, dhatus and shrotas involvement. So when injury happens in the acute stage, the dhatus which are being affected is rakta dhatu, means the blood, which happens due to bruising or internal bleeding. It may be external and also internal. So mamsa, it makes the tears like many tears happen because when it is bruising, there will be obviously the sign of tear. So after when it is coming to the after bone, it give rise to the fracture depending on the intensity of the blow which is happening. The fracture will be happening. Then to the snayu, when muscle involvement is in minimal level, it may give rise to the sprain or strain. When it is reaching the ligaments and the tendons, that is called as the snayu, it will give rise to strain or sprain. Then in other Toto channel blockage delays healing and the energy flow. When the acute injury happens, these are dhatus get affected. Due to this dhatus are affected, the blockage of the channels happens. Then healing and the energy flow will be interrupted. So we are in a stage to give the treatment, whether it may be external or internal, to increase the healing process and also for the energy flow. So majority of our doctors needs to know whether we are following orthopedics or the general medicine or whatever the domain it may be. We need to know about the assessment and the diagnosis. So when it is coming to the assessment, the more we have to know the history of trauma because the trauma may be the direct injury or indirect injury. So we should able to know where the exact impact is being taking place. Whether the fracture, if suppose a fracture case is there, that fracture case may be avulsion fracture. For example, there is a march foot. There is a disease condition called as march foot. When it is doing the march in the army training, when you are keeping your legs up down, then it may give rise to the avulsion fracture, which is also called as this march fracture calcaneal fracture because when we are jumping from the very certain height to the lower area, then we might experience the fracture in the calcaneum bone. So for that, depending on how the trauma gets happened, it may be direct or indirect method. If with the help of this method, we can able to know how this injury will be. Overuse. This also happens in the injury, sports persons. When a sports person or a gym going guy, when he lifts a weight or when he runs for too much or long, he gets fatigue and it will eventually lead to the muscle tear and other sort of issues. So that history also is very much essential when we are assessing the injury case. So type of sport, why this sport is also very important because in sports, maybe when he's going for a cycling or he may be going for other sports like gymnastics or weightlifting or cricket or football. In football, there is a more amount of knee or ankle ligament tear or sprain. Whereas in cricket, we have seen more of shoulder ligament tear and also we have seen frequently we are seeing that in kabaddi sport we are seeing the sport injury like very commonly we can see the shoulder dislocations due to the stretching of your shoulder muscles because it has core muscles yes ita supratendinous infratendinous then the teres major and subscapularis. These are the muscles which are forming the muscles of the shoulder joint, which is also a big joint. So we should know what type of sport he's playing. Then we can assess uh, how the impact of injury it will be. The onset when it is happening, because suppose if a patient is coming to the clinic after 1 day of an injury of suppose if sport he is playing in cricket or and, when he's coming, then it might go to the stage of second stage where more inflammation reaction maybe takes place, then swelling will be more. Then we need to go for then imaging spectrum where we cannot be able to find whether the fracture happened or sprain or anything in the ligament injury are happening. So we cannot able to find when it is going above the golden hour. So then we have to go for the inspection, palpation, ROM tests. That means range of motion or movement. Then imaging, inspection, when what we are seeing, then what we are looking, we can see the redness, we can see the bluish, when it is becoming bluish, then there is an contusion is happening. Then palpation, how the injuries when we're touching, we can feel the warmth, and we can see the other external changes is noting. Then ROM, whether he can able to move the limb or the specific muscles, because whenever in injury, in a fracture, he cannot able to lift the arm. But in other than the fracture or a muscle injury or any ligament injury, he can able to lift the leg and he can able to perform some actions which confirms that he is not being into major injury. So ROM tests are very important. Imaging. Nowadays, imaging is becoming a must rule for the doctors, because even we cannot able to find out many minute hairline fracture, then we will be treating this disease as that condition as other such disease, giving movements and other physical therapies and other external treatments, because the basic rule of that in fracture will be in a some other protocol and we will be following in a some other protocol. So it is important or it is necessary to go for an imaging when a patient is getting injury, when we are not sure about the distinguishing of the type of injury. So coming to the Ayurvedic view, we see as an assessing the dosha imbalance, because we see it is as an tridosha theory. So in that Vata Pitta Kapha is there mostly due to the injury. Vata and the Rakta gets dushtam and it gives rise to the inflammation part. So Dhatu involvement is Mamsa, Asti and Snatch. So these are also we know that evident in both in uh, modern view also it is being getting into that. So Srotorodham and Agni Dushti also plays an important part in Ayurvedic view in that injury spectrum. So we are coming to the acute phase management. So when an injury happens, 0 to 72 hours, that means the acute stage, we should go for a RICE protocol. So RICE protocol is not only being confined to the modern system, it also being confined to all the systems where an injury being happened. It will be for animals, it will be for humans, everything. This RICE protocol remains the same. So the RICE protocols we follow is RICE, R for rest, I for ice, and C for compression, and E for elevation. So this protocol we have to follow. We have to give the patient rest, and we have to give a cooling nature products like ice we can keep, or a cold water we can keep. So depending on that we can give compression. We have to give stability. We should not make the patient to move, because there may be a chance of fracture when we are moving, or it may be a severe injury when we are moving. It may get worsen, it may get injury to the nerves, so etc. So elevation, we should keep it in an uplift position or in a proper position, not to move in a normal motion, or you can keep it in a compression level at a normal phase. You should not move at an acute phase. So then afterwards, they will be going for the pain relief, like medications they are putting. They will be giving IV like a tramadol or any other medicines. Then immobilization they will be giving with the help of a POP cast, and now they are using fiber cast, or else they can assess for the X-ray or MRI. Then they will be going for an surgical procedure, whichever is necessary. So when we see about the Ayurveda, we see it as Vata Rakta in the acute cases, because we have gone through that when an injury happens, blood rushes
Then it forms an inflammation. So that means Raktam and Vada Dushti happen. So the severe pain will be there unless we are bringing it to a normal position. So we can also apply when it is coming to the rice protocol, we see as an ice. Even similarly, we also have an oil called Muriven. In Murivenna, it is prepared with the medium of coconut oil with the Shita Viryatravya. So we can give Dara by when it is not declared as a fracture or an injury is there, we can give a Dara with the help of Murivenna or Pinda Thailam, which is in Shita in nature. Then afterwards, when it is merely an injury, we can go with Nagaradi Churanam, mixing with rice, wash, water, or the crushed coconut outer shell with little water. You can make a paste, apply externally, leave it for 45 minutes. Then you can go for the external application of oils, whichever is necessary. Because Nagaradi Churnam is something where Cheninayakam is present and along with that some Ushnaviryam is there. So when it is combining with this, it gives an muscle relaxant effect and also a medium heat effect so that the blood flow will be good. In the Jadamaya Churnam is necessary whenever there is a more amount of pitta where we can see a contusion, where we can see a high level of pitta involvement, inflammatory reaction. That time we have to go for Jadamayadi because with this is in cooling in nature. So we can mix it with water, warm water, and apply. Pottam Chukadi is merely Ushna in nature. You can give it in an not in an acute stage, but also in the other upcoming stage where the stiffness is being seen. So these are the churdams basically we use for giving quick relief and also for acute pain relief and pain management. Also, this is very important because Vedana causes pain relief. So this will make you Rukshanam there. Then will be in case of blood rushing to the target cells and by application of oil it will get absorbed and that oil should be in the Shita Virya nature so that the inflammation can be controlled and the repairing mechanism can be started. So by coming to the internal medications, we see that Muftadi Marma Kashayam on an acute phase, it helps the inflammation process and the injury to get recover as soon as possible. Also, the Manjishtadi Kashayam, which is confined to the skin, but also it repairs the blood where the capillaries are being injured and the blood is being poured into the internal organs. So by giving the Majistadi Kashayam, we can able to control the blood. Then Lakshadi Gugulu, where it is directly indicated in the Bhagna chapter. So if there is injury or if there is blood capillaries is being ruptured, then we can go for Lakshadi Gugulu. Kaishora Gugulu is directly indicated in Vadaraktam spectrum. So it is also a Vadaraktam where the Raktam is getting vitiated. So we can indicate the Kaishora Gugulu. So these are the basic medicines where we are using in Ayurveda for the injury management. Subacute phase. This phase comes after 3 to 21 days. So here in the subacute phase in the modern gradual mobilization and physical therapy. So what happens is they will be reducing the splint or the cast which they are removing and the mild mobilization will be there, then they will be starting the physiotherapy or the physical therapy. But in this stage Ayurveda is not directly going to the physiotherapy. It is now being in that is the beauty what we are following. How does the Ayurveda helps in injury management? Because we see as an avastha. So in this case we are not going directly to physical therapy, but we are going for in our principles of Abhyangam, Svedanam, and Brahmanam Sikicha. So in Ayurveda, Abhyangam with Danvantara Thailam. Danvantara Thailam comes the next stage of acute, where in an acute stage, most of the Vata Rakta Dushtam is being happened. And when we are coming to the subacute phase, inflammation comes down, then the repairing is needed, where Danvantara Thailam is Brahmanam nature. Then we are giving the Danvantara Thailam for the tissues to regenerate and to become the normal stage. Then Mahanarayana Thailam. This is also a Brahmana type of Thailam where we can external apply. These two are very much used in the ligament tears where we can see in the ACL tear or PCL posterior cruciate ligament or meniscal tear or in the sprain or a strain in first degree, second degree, and whatever the may the conditions when it is coming after the acute phases in the subacute phases, we are giving this Thailam. So then Swedanam, in some conditions when the cast or the POP which we are putting, or in the suppose in the bandaging where the oil is not proper, people will develop stiffness complications. To overcome this stiffness complication, or we are not giving a proper care, it will give rise to the stiffness complication. So to remove the stiffness, we are putting the podikili, elakili, and dhani amlakili to remove the stiffness with the help of the oil which I mentioned before. So podikili is nothing, we all know that it is a Ruksha Svedam. Yelakili is a Snigdha Vedam, and Dhanyamlam is also a Ruksha Vedam. When it is more of a armor, we will be first choosing the Dhanyamlakili. So when there is more of a stiffness along with the swelling, we will be going with Dhanyamlakili for 3 days, or the subsequently by we can do with oil or without oil, depending on the condition of the patient we are giving. But it is very much indicated, or very much it is needed in the case of where more of stiffness is there. We can directly go with the Dhanyamlakili where it will give you excellent result. The podikili is confined where a particular region of muscles or particular limb is being getting affected, then we will go with podikili. Then for the Brahmanam, we are coming with Yalakili, then it gives you some Svedhanams, Snigdha Svedhanams for the stability of the muscles. Then internally, when we are seeing, we are giving Danvandram capsules and Mahanarayana Thailam capsules and Gandha Thailam capsule. So already we are mentioning that the Anvandar Thailam is being indicated when Abhyangam of local parts. Internally, it is an Avarti, the Anvandram 101, by giving the regeneration of the cells takes place. And the Mahanarayanam Thailam also, it is indicated for the regeneration. Then Gandha Thailam is also being indicated in the Bhagna chapter, fracture, and also for the injury. So we are giving in this type of medication in Ayurvedic style. So we are coming next to the recovery phase, which is 3 weeks to 3 months. In this modern, they are going for strength training and rehabilitation. So here only we are following the rehabilitation, and we are following the rehabilitation in the yoga. Yoga, which there are many type of yoga because it depends on the conditions, and we are also giving a specific marma points for the recovery stage because it will improve the blood flow to your organs where it is being injured. Then it will also give strength to the marma points and to the subsequent limbs. So we are coming, see, when the beauty is that in the before stage, we are preparing the patient to get full strength without any complication for the recovery phase. So we are compacting the complication in the before stage itself when compared with the other medicines. So then we are going with the lepam. The lepam is being indicated as before. We are giving the lepam, Brahmana type of lepam that can be mixed with milk. Before we are putting with warm water or rice washed water, etc. But here, when it is coming to the recovery phase, to give the dhatu poshana, the pushti, we are mixing that churanas with milk. That will be in Brahmana nature, and that will be giving poshana to the specific part. Then Rasayanam, we are going with the Rasayanam therapy, which it is Chavanaprasha, Ashwagandha, Lehyam, Narasimha Rasayanam. Chavanaprasha, we all knows that it will be giving full type that all the type of Brahmanam, all the type of injury where the Amalaki is the main ingredient. Ashwagandha, yes, of course, Ashwagandha is present. It is very useful in the nervous injury or the stimulations, and the Narasimha Rasayanam we are being used in the later part. So preventive and supportive care. Actually, the it will heal when an fracture injury is being managed, then it will heal on its own. But care to be taken that the injury should not be healed in a wrong position. Improper position leads to the disturbance of biomechanics of the body. When the biomechanics of the body is being get affected, then we cannot able to do the other works as before. Suppose you are getting an injury in your foot, you are not being say for example we can take a sprain. When we are treating the sprain in a not in a normal positions, in an outward position, normally we should be treating the sprain in an inward position, but when we are going in an outward position, that means outwards the body, the ankle, then it give rise to the pain in the back region or a repeated injury of the ankle, it will disturbs the calf muscles, thigh muscles. Then there will be more pressure on your ankle. Then a repeated injury of sprain will be taking place. So it is very important to correct the biomechanics of the body through marma. Here we are using the marma points. There are many marma points. We are using gulfa marma. For example, when we are going for the sprain, we will be starting with the intrabasti marma, coming to the gulfa, then we are coming to the shipra, and finally to the talahridayam. So when we are pressing those points, then application of oil, then by keeping the pichu or the medication which is available, then stabilizing with the help of the oil, that may be murivenna, that may be danvandara tailam, depending on the condition or the avastha of the patient, we are treating the patient without any complication in Ayurveda by assisting the avastha of the patient. So use medicated oil pre and post exercise. Suppose if you're going for a yoga or we are giving an exercise to do for the particular limb as a rehabilitative part, then we should be using the oils to prevent the stiffness and also to prevent the further damage of the tissues. So we are using in the medicated oil, as we mentioned, we will be using all those oils. Mostly we will be giving mixing with the Karpuraditailam, as Karpuraditailam has already muscle relaxant property. So when we are mixing along with Danmadara Tailam and other Tailams in the rehabilitative part, it is giving a very good result. So maintain Dinacharya and the seasonal routines. Because here the Dinacharya, they're implementing that the normal regimens they have to follow from the next day to make your body biostatics, biomechanics in the normal positions. Because we are getting early in the morning where the Vata Anulomanam will be happening, and then the next subsequent days it will be happening. So the season routines are happening because all will be having the impact on your each and every body cells. So it is important to maintain the Dinacharya and the seasonal routines. So specific treatment for each avastha, pages or avastha. So it is like an concluding, we are seeing why there is Ayurveda has a special role in injury. Because we need to understand what is the difference, because many people wants to know what is the difference between the allopathy and Ayurveda and other systems. Because when we are giving the oil bandages are very common, as a last series I have spoken about the oil bandages, then the difference between the oil bandages was discussed earlier. But now when we are discussing this specific treatment for each stage or avastha is being given by us. Because when we are putting a POP, then we are waiting for an 1 week or 14 days to wait. But in an Ayurvedic physician treating the patient, we will be making the patient to come for routines 3 days, 5 days, so that what we are preventing the complications. The patient may be allergic to the oil, the patient may be allergic to the, say for example, when there is an hot climate, the patient is getting some injury, then we are putting POP. The patient, if he is a nature of Pitta Prakriti and when he is having more of sweating in nature, then normally the patient will be having 5 days of POP when for a small 1 week they'll give for a small cast. Suppose he's having more of a hyperhidrosis, he will be getting more of sweat, and the sweat will be kledatvam, and that kledatvam will be giving rise to the other infections, skin infections. Then patient will feel itchy, then the development of other skin issues will be happen. But we are regularly making the patient to come 5 days because it is an oil. Oil also have an antifungal and antibacterial properties and also with the healing property. So the muscle injuries are being coming down, and also for the antifungal property has also been developed, so there will be no skin infections. And also we are cleaning regularly 2 to 3 days, and the fresh bandage is being used, so there will be no odor and there will be no infections around you, whether you are in a place or anything. So it is a very important point. The complication avoided as a focus is given for each stage or avastha. As of course, when we are changing the bandages for 5 days or 6 days, or when the injury, when they're coming for recovery phase, or when we are coming for subacute phase, we will be noting some complications. Suppose the patient will be walking in a wrong positions, or the patient will be telling some other complaints which are associated, because some people may develop muscle strain after when focusing on one muscles, and the other muscles in the upper limb can be get due to the biomechanics of the body. So when we are in an changing of the bandages, or when they are in coming for the next treatment or in a follow up, the complications can be avoided depending on the stages, as we have more of medicines for the stages. So it mainly focuses on the homeostasis of the body, because when acute injury happens, we have seen that Muftadi Marma Kashayam is being helpful in regulating the blood flow, and also by repairing the more of injury. But in the later cases, when it is coming to the subacute cases or in the recovery phase, we have seen that Dhanvantram is being used. Both have the Marma Abhigadam reference and also injury reference. But the difference is Dhanvantram is Brahmana Kashayam, where Shiram is having, whereas Muftadi Marma Kashayam with the Shita Viryam. So when we are giving this body, not only the injury part, the other parts of the body, whether it may be GIT, whether it may be neural system, whether there be muscular system, whether because each muscular system has a connection with one or other. So when we are giving correctly, when we are giving and assessing the patient and we are giving the medicines correctly, the homeostasis of the body is also maintained. So healing with natural medication. Yeah, of course, we are not giving any much painkillers. We are not giving any corticosteroids, or we are not giving anything. We are giving the pure Ayurvedic medicines which have the nature to heal. So by these four, we can able to know that we are treating a more better than the other systems, as we are giving more attention to the patient for each and every stage. So we have to develop a condition of assessing, because if we assess on because when we are seeing, we should not able to misdiagnose or know about the injury, because we all should know about the acute injury, because the acute injury is very common, because it will be happening in our home, or it will be happening in our relative homes when we are going in a traveling. So in the basic, we need to know what we are doing, because in that way we can develop a specialized ortho section in Ayurveda, because everywhere it is being getting popular. Our Ayurveda is also being getting popular. But when we are going into the injury management, we can able to give a more successful treatment when compared to other systems, and by the main important point, by reducing the complications and the each stage of specific treatments for the injury peoples. So inflammation can be controlled with the medicines, then the specific treatments for the avastha is being given, and more other medications for internal, for the maintenance of the homeostasis, everything is available. So we should clearly focus and apply on the patients with some marma points, where this marma points is being regulating and being very much useful in the rehabilitation process. So this is why the injury management is Ayurveda is, in my opinion, it is a way more better than other normal POP or normal management, because we focus on the avastha and to avoid the complications before the stage of more complications. So thank you for the opportunity. Then we will be discussing about the next other topics in orthopedics or some others. So thank you.